we have been trying to create courses that dive a little bit deeper into this world or into the world of morphology and biology with dermoscopy. So it's not just trying to memorize, for example, that leaf-like structures associated with basal cells, but to get a deeper understanding as to what the leaf-like structure actually means and its implications in both tumor biology and in terms of management. So I am super excited to sort of give you a completely revamped view of dermoscopy through a series of 8 lectures that we're putting together, and that'll be the boot camp through DermEx that we will present. And I'll sort of go through the entire framework of dermoscopy. So how did dermoscopy, the inception of the framework, the two-step algorithm, why was that created? What did it lead to? And then kind of give you a little bit of the evolution of dermoscopy. And that's even before we get into the meat of the structures. Thereafter, we'll talk a little bit about the importance of understanding the physics of the light sources that we use, so both polarized light, non-polarized light, but now even UV dermoscopy. And there's some pretty cool insights coming out of UV dermoscopy as well. And just today, I had a patient with an invasive melanoma who, on UV dermoscopy, had a very unique color, which we call the ochre color or golden hue. And that is indicative of invasive melanoma. And these are the things that I will kind of highlight, sort of bring you up to speed on the newest um, insights that we have for diagnosis and prognosis. And then we'll go from there on to lectures on histopathologic correlates of dermoscopic structures. And I think that, at least for me, is sort of the foundation of dermoscopy. If you can understand the structure that you're seeing and what it corresponds to histologically, you can make sense of pretty much any lesion that you encounter, at least in terms of from a management perspective. And then after that, we'll sort of dive down deeper into intradermal nevi and dermatofibromas. And while you may initially say, well, that's pretty boring. I know what an intradermal nevus looks like and a dermatofibroma. Stay tuned because you'll see that the world of intradermal nevi is much more interesting and exciting and a lot to learn in the world of intradermal nevi and for dermatofibromas as well. And so, you'll have a lecture. Can you imagine a half hour, a 40-minute lecture on just intradermal nevi? How is that even possible? But you'll understand sort of why that much time is required, even for what we consider to be the simplest of lesions. We'll also talk about the entire universe of nevi, which is not just the dysplastic nevi, but it's also Spitz nevi and blue nevi, congenital nevi, BAP1 deficient nevi, and we can go on and on. There's so many different variants of nevi, and we'll kind of go through each category of nevi and what their histopathologic correlates are and what their dermoscopy features are, so that you can understand how to make the diagnosis prospectively, and then more importantly, what that nevus actually means to the patient. So, example, if you were to diagnose a BAP1 deficient nevus, you would need to start wondering whether this person has a germline mutation in BAP1, and then sort of bring up the issue of screening for renal cancer and mesothelioma and ocular melanoma, among others. We'll also talk about the universe of seborrheic keratosis. So again, a very simple tumor if you think about it, but yet there's an entire hour dedicated to seborrheic keratosis. And even in that hour, I don't think I can do justice to what we have learned about seborrheic keratosis, and hopefully I'll make it exciting for you as well, and sort of give seborrheic keratosis its due respect. And then for there, we'll go on to talk about basal cell and squamous cell and melanomas, and talk a little bit about the new insights in morphology as well as biology. Talk a little bit about overdiagnosis when we get to that section. In terms of who should attend, in my view, meaning who should attend the boot camp, in my view, anyone that is interested in uh, making themselves better, in that they want to improve the care they deliver to their patients, um, as efficiently and as accurately as possible, and to help in the management of patients. So it's really a way to make yourself better, with the goal of being an advocate for your patients. So it doesn't matter. I mean, if you are a seasoned expert already, I'm sure that you're going to get some insights here. If you're a novice, you'll get both the foundation and the insights. If you are anything to do with skin, you're a surgeon, plastic surgeon. I would say even if you were an ophthalmologist, you're dealing with the skin around your eyes. I mean, anything, any sort of clinician that is coming face to face with a patient and the skin is there and to some extent is being evaluated, would benefit from the boot camp. Um, the unique features of what we have put together is that the boot camp is not just me giving you didactic lectures, but it's going to be somewhat interactive. So there will be so it'll be alive, obviously. It'll also be recorded, so you could also hear that, but it will be live, and you can then also raise your hand, ask for questions. We will record those questions on the back end, and then at the end of each session, we will then address the questions that you had. In addition, we'll provide you with a channel to send us questions afterwards so that if you had anything that you were pondering about that you wanted to have answered, we can address that even after the lecture at some point over the course of a week or so. We'll also sort of have intermittent quizzes in between just to test a little bit your knowledge and keep you engaged. And at the end of it, at the end of the boot camp, we'll sort of have an exam that will be based on all the things that we spoke about during the course of the lectures. We also have a structure where we've created a logbook. So basically what that is that anybody who is participating in this boot camp will be able to submit 5 cases. So again, there should be somehow cases that bring that are difficult for you or that you have a question about, and you can then submit those cases together with your annotations and your questions about the case, together with the histopathology, and then we will address those questions. And to make it a little bit more exciting, we'll also have a separate avenue for those individuals that would like to have a one-on-one session live. So we could actually say that you sign up for the logbook, with the one-on-one logbook. Then basically you would just submit the cases, and then you and I will sit together via Zoom for half an hour and kind of discuss the case, and I'll address any questions you have during that period of time. So we will try to make it as exciting, as fresh, as new, as innovative as possible. Try to engage you both during the lecture, during the quizzes, during the exam, and during the logbook itself. And I think that's what makes this course exciting for me. I think it does bring a little bit of a different platform, and hopefully will also excite you as well. And then to sort of put this into the next realm, so once we have completed the boot camp, in essence, you'll have a very solid foundation for dermoscopy. And